In 2013, in order to rejuvenate the region of Berd and empower its local population, the ambitious program Breaking the Cycle of Poverty in Tavush Province and Saving the New Generation was launched through the generosity of Edward and Janet Mardigian. It was preceded by a thorough study on child malnutrition in the region, which revealed serious problems. Among others, parents lacked the knowledge to raise a healthy next generation. In order to counter these issues among children between 6 months and 6 years of age, Fund for Armenian Relief launched the Children's Health and Nutrition Initiative within the framework of the Breaking the Cycle of Poverty in Tavush Province program. The aim is to combat malnutrition and anemia, as well as to prevent general physical, neuropsychological, and cognitive disorders in children. Before, we were giving the children ordinary meals in our kindergarten. Then the food that was sponsored by FAR became so plentiful, so now we don't have repeat meals, and the children don't get bored anymore. A menu was developed for the kindergartens of the region of Berd in accordance with national and international nutritional standards. The balanced meals provided by these kindergartens have not only promoted healthy growth and cognitive development in young children, but have also significantly enhanced their immunity to a number of diseases. Everything FAR provides is delivered to our kindergarten on time. It's never been late, and it's always fresh. The fruits, vegetables, juices. This initiative has established safe and enjoyable eating conditions for children. It organizes regular meetings with parents and community seminars and courses on public health. It's working to shape a culture of healthy nutrition in the region of Berd, and more recently in the regions of Yerevan and Noyemberian. My children would come back from kindergarten and tell me that they had eaten lentils, so then I asked for the recipe, and now I cook it at home twice a week, and my kids love it. So we took the meal actually from kindergarten into our home. There are a number of different meals that you can make from the same set of ingredients. For example, we like casserole. That's a dish made from cabbage, eggs, butter, and the cooking method was a little bit different. At the beginning, our staff didn't really know how to prepare it, but then we learned, and eventually we started cooking it at home too. FAR's efforts have been enthusiastically received by the local community. There is a significant increase in the number of children attending kindergartens and schools in the region. Over 10 years, more than 3,500 preschool children have received a balanced diet. Over 500 seminars on public health topics have been attended by more than 5,000 residents of the Berd region. The dining halls and kitchens in more than 20 kindergartens were completely or partially furnished or renovated. Over 100 healthcare workers have been trained through FAR's continuing medical education program. More than 20 medical centers have been renovated and equipped. Most of the primary healthcare representatives in the Berd, Yerevan, and Noyemberian regions serve the residents of several adjacent communities. They also play a special role in raising the awareness of the population about critical public health issues. Here, a therapist is often also a pediatrician. An ophthalmologist might serve both adults and children. In order to ensure that specialists receive up-to-date information and knowledge in their fields, FAR organizes free 4-week trainings through the continuing medical education program in the leading clinics of Yerevan.
Our nurses took training courses at the Fund for Armenian Relief's office. They were actively involved in FAR's healthcare programs. As for me, I've taken continuing professional training twice. While I previously supported about 20 to 25 pregnant women per month, I am now able to work with 60 to 65. And due to the professional training we received, we can now provide specialized services in our region.
In order to ensure higher quality of healthcare services and access for the whole region, hospitals and community outpatient clinics have been furnished with essential medical equipment. This has successfully contributed to greater healthcare access for the whole population of the Berd region.
We have a wonderful achievement in our laboratory assistant Hranush. She worked at the Institute of Molecular Genetics and has a PhD in biology. She left Yerevan, is already working in our region. She's a treasure for us. We just need to make use of her capabilities fully.